welcome to Vet with Pets podcast. I'm Elliot.
And I'm Becky.
Thank you to Vets for Pets Hereford for sponsoring.
If you can hear some music in the background, it's Pets at Home having a party while they put all the stock out before they open.
Yeah, we just had a false start, didn't we? So we started and then the camera was wonky and then I've had to turn the fans off. And now Pets at Home music is blaring. So.
We're ready to go.
Right. Yeah, we've not got much planned to talk about today, have we? We need to get some more guests organised. I've got multiple people I need to email.
Yeah, and me.
I've just not had time.
It's been a really...
Not prioritise the time for that as well.
Yeah, because it's just been a really busy 3 weeks, hasn't it? Should we start with our pets? What's gone on with... Because you've had a few goat shows.
Yeah. What's happened with mine? So if I work backwards from now, it's probably the easiest. I think it's probably about a month since we last recorded, if not slightly longer. I had a couple of goat shows last week. So we were at Rutland Show on Monday. Sunday. Rutland
Sunday.
Show on Sunday.
Yes.
So we went up there Saturday because Esther was entered into the milking competition. So I don't think I've gone to the milking competition before, have I?
No, because when you said you had to go up early just like so you could milk her,
So
funny.
With the goat shows, the way I describe it to the public when I'm talking to them there is it's not just like a beauty pageant. The female goats have got to work for it as well. So
Apollo gets away with it. He just has to turn up.
Yeah. So Apollo didn't go to the show. This was just for females. So
it was a female-only show.
Yeah.
That's funny.
Which I'd like to take the boys. I'm going to see if we can take the boys next year.
Yeah, just to show them all.
There's people that get worried they're going to escape and mate with everything, which is fair.
Okay.
But then I think you just contain them.
Yeah.
And then I think primarily the reason there's no boys at these type of shows is because they smell.
Oh, okay.
And I think
you didn't want to put people off.
Yeah, they didn't want to put people off keeping goats. That's one story I've been told anyway, so I don't know. I don't think he smells that bad, but I'm nose blind to it.
He's not as bad as a lot of goats, I don't think.
This time of year he's fine.
Yeah.
For Sherborne show, I shampooed him 4 times over. Emily had a load of shampoo that, I don't know, maybe this is a normal thing if you're female to buy different types of shampoo.
Yeah, it is.
I don't like that
Because sometimes
shampoo.
it doesn't suit
I don't like this shampoo.
But it's not. Sometimes it makes your hair greasy. Sometimes it doesn't. Sometimes it can make your skull pitchy. Sometimes it makes your hair too fluffy. And Emily's got curly hair, so that's really hard.
It's a good job that Apollo is not as fussy. Apollo used up. Well, I got the wrong phone recording. I can't remember what brands it was, but anyway, he had some rather expensive shampoo. He took 4 lots of different shampoos and then conditioner to get the smell out of him and get him looking smart. But anyway, milk recording competition. So the idea behind this is that you milk over 24 hours. And then you calculate how much has been produced and then measure fat and protein content. So we got there on the Saturday afternoon, about 5 o'clock. I think we got there just before. And then the goats are all stripped out. So you milk your own goat until there's nothing left in the udder. And then a steward comes and just checks that there is nothing.
That you're not
left.
cheating.
So you're not cheating. You're not left some in the goat. And and so then the following morning, so about 12 hours later, supervised, everyone milks their goats.
Do you have one supervisor for each person, or do you all do like a group milking?
No, you all have to milk by a certain time.
Okay.
So it's always quite funny because you've got like an hour or so to milk.
Oh, people want the latest one, so that they've got the most milk.
So you all have to be in the tent. You're all like zipped into the tent, so no one can go in or out. and then they announce that you can start milking, and everyone just stands there with their arms crossed or talks or whatever because I guess you want to leave it as late as you can do.
To get the most milk.
So then I'm there thinking, how long does it take me to milk Esther? Like, it takes about this much time. So you have to start so you can finish at like the last minute. So then when you finish, you put your bucket of milk on the table. So everyone puts their buckets on the table.
Yeah.
You supervise that you don't like add anything into your bucket.
You wouldn't want to water it down, would you? Because it will affect your fat and your...
Exactly. So that might increase the quantity, but that would decrease the value of the fat and protein. But you could have a stash of milk, I guess.
Yeah, that you just quietly...
Anyway, so all supervised. All the buckets are then on the table. And then the chief steward goes through them and weighs each bucket of milk. So they're they're decanted into a weigh bucket. So everyone's milk is weighed in the same bucket.
Okay.
And then the samples are taken. And then the samples are sealed in a box so they can all be sent away, not be tampered with. And then you repeat the process again. So that was in the morning.
Yeah.
Repeat the process 12 hours later in the afternoon, early evening. So the rest of the show's packed up, all the tractors are gone, all the horses are gone, and we're all just stood there.
You just got to wait to milk.
Waiting to milk the goats.
So then do they add the scores together of the... How does that work?
So let me... right, I'm going to try and get my... This is the old phone, which I've got.
So then, do you get a prize for the most volume and a prize for the quality, or do they both add both together and do like an overall?
So the goats are then shown. So you do what's called a full udder inspection, which is where they you take them out to the ring, and then the judge assesses the udder size.
Is it while they're full of milk?
Whilst they're full.
Okay, so they get a score for that as well.
So the judge. Well, it's more that the judge judges them, so she gets an idea of the udder. And then they're brought out again later on for the proper judging, where you'd be awarded the rosettes and that sort of thing.
So you have an udder judge and then an overall goat judge?
Yeah, it's the same person.
Oh, okay.
It's the same person. Yeah. I'm just getting the results from Rutland. So Esther... So there's the show results and there's the show milkings. So Esther did 2.3... litres of milk in the morning and then 1.9 litres of milk in the afternoon. So it's quite normal to have less in the afternoon compared to the morning. So the fat in the morning was 4.38% and the fat in the afternoon was 4.63%. So
she has less milk in the afternoon, but it's more fatty.
Yeah. And those fat levels are pretty good for her. So the last recording I did at home was like 2.something%, but she produced much more volume of milk.
Oh, okay.
So it's interesting at the show, she won't eat and drink as much.
I was going to say that. Do they get dehydrated?
Yeah,
I thought
and
that.
a bit more pressured. So it's interesting that actually at home, if she drinks more, she produces more volume, but the fat content doesn't reflect that.
It's healthier for you. It's lower fat.
Maybe. And then we've got the protein levels. So 2.22% in the morning and 2.18% in the afternoon. So then they do some calculations, and then magically that gives her 16.33 points, whatever that means. And then, so the range of points in the show was from 29.94 was the top goat. And then the bottom one that was recorded was 12.11.
Okay.
So she's somewhere sort of like...
In between.
Yeah, in between. Mid-range.
It reminds you, there's a film called... I'm sure it's called Best in Show. And it goes in behind... It looks like a documentary, but it's a film in the dog show world. Yeah. And they should make a film of that, of the goat world.
Maybe one time I'll persuade Alice to come and do some filming.
Yeah, you could do an actual documentary.
It would be like a soap. It would be like it's like...
You could go around and talk to all the other people and like what shampoos they use and I bet there's so many weird little things that people do.
Yeah, literally.
Yeah.
Like we were talking about some of the diet stuff, and someone was like, figured out that the goat was under condition, so you can add linseed to some of the other English goat breeders. And we do that anyway. So
that will probably add fat to the milk as well. In theory. And omegas, I would think it would. Yeah. Can you test the milk for what omega oils and stuff?
I presume you could test for it, couldn't you? Cool. But they don't test for it. It's just the fat. And the reason you're interested in fat and protein is that historically, then that means it's better for like butter or cheese or whatever.
Well, I suppose for the kids as well, if they're actually feeding kids.
Yeah. But it's interesting. So the goat who produced the most volume of milk, to be fair, is an Anglo-Nubian, and actually they're not renowned for producing that much milk. But she did 4.25 litres in the morning and then 3.5 in the afternoon, which is impressive.
That's mad.
But yeah, Esther didn't milk too badly. Although she's a bit wonky and her udder's a bit saggy nowadays. One of the judges' ending comments was that she's better off in the pen than staying in the public.
Oh,
which is a nice way of saying that she's not.
She needs to retire.
That was the milk recording. Carol, who was our goatling. So a goatling is a goat that's over a year of age.
Okay, so they're not a kid, but they're not an adult.
Yeah. So when they get over 2 years, you can only show the females if they're in milk.
Oh, okay. So it's like you can only show entire dogs in dog shows, I suppose.
I guess
because
so. But then you could have an entire female goat who's older, who's not in milk, but then because the idea is that they're a production animal, then you wouldn't be able to show them. Although, so Sherborne show, which we took all the goats except for the two boys with broken legs. Yeah, that was the week before. At that one, I had organised the classes there, so I'd organised companion goat classes. So if you've got a male neutered goat, so a weather goat, or a female who's not milking.
Oh, that's nice. So they're pets,
then,
really, which is a much bigger thing now, isn't it? It's like
that's
the
the main reason why people keep them, really.
Yeah.
And despite what all the other goat competitors would probably say, I mean, like, they're a hobby, really. There's very few people, I would say, that would exhibit and show the goats that would genuinely make a living from them.
Yeah.
There are some that I know of, but I think they're probably few and far between. But yeah, the most important thing for us is the goats enjoyed it and they were really well behaved. So particularly at Rutland show, the second show. I mean, Esther's a pro. She's really good. It was funny in the show ring because right next to the goat ring, and this was ridiculous. They had like a motocross motorbike demonstration ring, right, like 10 meters from the goat ring. And
but you can't have male goats there because that might distract them.
Exactly. We can have motorbikes. So there was the goats and then the heavy horses next door, and then opposite both of us like a motorbike ring. Ridiculous. Anyway, our goats weren't bothered. I'm used to a bit of noise and chaos and stuff. And Carol was actually just watching them during the time she was out in the ring. And Esther just stands there just chewing a cud, and then just walks so slowly around the ring. She's just like come on,
she just doesn't
look
care.
lively. And she's like, no, in my own time. And yeah, like some other people's goats, people did really good bringing the goats out to show them, but there were some that were definitely just throwing a paddy and didn't want to be there. More that they didn't want to be led.
Yeah.
Because with ours, for the last 3 weeks or so up until the shows, most mornings, probably 5 out of 7 mornings a week, what I would do is just put a collar and lead on them, walk them out at the end of the shed, just stand them still for 30 seconds or so, and just walk back in.
So they're
just to get used to what you're going to ask of them. And so they knew the deal when we got there, and they were really well behaved. And you can tell the goats that are used to it and the goats that aren't. So that was a goat show. So that was good fun. Yeah, and there's always crazy people, including us.
Yeah. But then you had a bit of drama beforehand, didn't you, with the first? Yeah,
so the first show, so Sherborne, so Sunday was our getting ready day. So we had all the goats to wash and get all the trailer and everything prepared. We weren't camping over, but we were waking up at 3 a.m. I think we got up, 3:30 a.m. So we knew we had a really early start and a really long day. So I got up 6 o'clock Sunday morning, and the first job is to feed Dougie on the bottle. So I made his milk, walked up to the shed, and he jumped over a gate in front of me and hung himself and broke his leg in front of me. And I was one gate away. I was like 2 meters away from him. So I couldn't do anything.
And so since January, you haven't had a day off where you're not on call, and we'd organised a locum. We'd ordered that weekend. We'd organised cover.
Shout out to Brookfield Vets. Yeah. So Kate was working the Sunday.
Yes.
And then Brookfield Vets were going to do the on-call for the Monday night.
So the one day you didn't have to be here, he decides
so I had to call
he needs to be here.
He did it in front of me. I unhooked him, got my phone out of my pocket. I called Becky D. I was like, I need you to come into work. I need to fix Dougie. So I could see straight away. It was just flapping in the wind, broken. And that was only 3 weeks after Dudley broke his leg. Yeah. So I've got 2 of them with the external metal fixator on. So, but hopefully Dudley, I'll probably bring him in this week and take it off.
Oh, that's quick, isn't it?
Yeah, I think it's about 5. I'd have to check my phone.
Yeah, it must be
about 5 weeks. And he's young, so it should be healed.
Yeah.
And he's probably like, I don't know, 2/10 lame. Like he's still a little bit lame on it, but it's good enough, so I'm sure it'll be fine. Yes, so that was the goat show.
And then before the second goat show, you had Toffee colicking.
Yeah. So I needed an early night. That was a Friday night. So actually, I think I had actually gone to bed relatively late anyway, and Emily gone out to the evening checks and to feed Dougie his evening bottle, and come back in because Toffee was colicking.
She always does it if you've got something planned, doesn't she? She just seems to know.
Well, she's had a couple of years and she's pretty good until recently. And then we've had a couple of episodes. So I just gave her the drugs and then crossed my fingers and went back to bed.
Yeah, and she recovered pretty
by
well,
morning. She was all right. Yeah. So that was stressful. But yeah, I think everything else okay. We've had the jackdaws, I think.
Oh,
I think
yes.
they must be new.
Yeah, because we were waiting for them to arrive at the last
so I've
one.
got the Avery sorted that we were previously making for Ozzy, the galah, who passed away. So it's now got the jackdaws in it. But that's not been without drama. So we've got Alba, the white one, Bob, the normal one, and then Wonky, the one who's got a gammy wing. So Wonky, so corvids are very territorial across all species. So corvids being crows, rooks, ravens, jackdaws, magpies. So we've put the jackdaws in the aviary, and every morning since, and several times throughout the day, the local crow family, so not even the same species, come and sit on top and shout at them. And the jackdaws don't seem too bothered.
No.
But I think Wonky must have been pecked through the wire because his eye, like 2 mornings after I had him, he was just fluffed up and very sad. So I caught him up, and he was really sore around the corners of his mouth. So they're very well looked after where they were before. I think I said a bit of the story previously. The guy's terminally ill. And, so well looked after, but I probably do slightly differently diet-wise. So they're on quite a wet, mushy diet. So he had an infection on the corner of his mouth, which I had noted when I first got them, but it was mild. So I thought, well, I'll change the diet. You don't want to change it should be quickly, okay. But it turned out it wasn't okay, so that got worse. But then his eye was all nasty, and I think he'd been pecked there. So then he was in a hospital cage for, 2.5 weeks, maybe even more. And the eyelids have all died off. Oh. So actually, the third eyelid is still functional, and the eye is functional. Okay. But he's lost about 2/3 of his upper lid and the entirety of his lower lid. But birds being birds, and he's got a third eyelid, luckily. He seems fine. So he's back out with the rest now. I need to catch him again, probably this week. The trouble is, I normally like to do it in the dark because it's less stressful. You can just grab them off the perch, they can't see you coming. But then the nights are so short, and I'd have to stay really late. And you've slept here 2 nights as well in the last few weeks. Yeah. But anyway, so he's doing all right. Well, that's been a bit of drama. So I've got two of the goat kids on medication at the moment. Apollo's been a bit of drama as well, because actually before the show...
Oh, yeah, the urinary.
Yeah, he's training to urinate, so male goats are really prone to urinary stones, along with lots of other animals, including people, I guess, does that make sense?
Yeah, so I think so.
So we put him on a urinary acidifier, but he doesn't like it. So initially the first few days, he's like, yeah, I'll eat my food, that's fine. And now he's like, no. So I need to figure out how getting it into him. So I got some baby porridge, banana flavour, because that's normally a hit with most things. He doesn't like the texture of it. He finds it really interesting.
Because it's claggy.
And then he gets it in his mouth. He's like, what's that? So, but I've started him on some meloxicam as well, so some anti-inflammatory pain relief.
Is he still straining, or is he?
No, I've not seen him.
Oh, okay.
Since he's been on the meloxicam, he's been all right. But I need to work out how we're going to get the ammonium chloride into him, the acidifier.
Yeah, it's hard, isn't it?
But so I was trying to hide the meloxicam in food. So he won't take it in jam sandwiches, he won't take it in peanut butter sandwiches, he won't take it on banana, won't take it on digested biscuits, won't take it in his normal food.
He's weird.
So I was getting really annoyed with him, so then I was just syringing it down him.
Yeah.
But he's strong.
Yeah.
And he doesn't like being syringed stuff.
And
so every morning was a battle. Then. And so the one morning, I was trying to get it down him and failed. So I just stood there, having a bit of a rage for a moment, just being like, Apollo, I'm trying to look after you. And he just came over to me and kept bashing me with his face. And I was like, what do you want? And I worked out, actually, he likes the stuff.
He just didn't want you to
He just didn't want me to squirt it in. So if I don't restrain him, he'll just come up to me and I can just put it into his mouth. So silly.
And he was probably thinking, I'm trying to tell you.
So now every morning, he just has his little syringe, he comes up and he sucks on the end of the syringe and I just squirt it in. So, and I was hoping he'd do that with the baby porridge, but no, he doesn't like the texture. No. So I'm going to get some molasses.
Yeah, I was going to say that or honey or something like that might be.
The only trouble is it's dental health then as well. He's having all that sugar a couple of times a day. So.
Oh, man.
But then the rest of his diet's good, so.
Yeah.
I don't know. Anyway, yeah.
Will you have to be on that now for life then? Or?
Yeah. Probably will, just to minimise the risk of it.
Yeah.
The trouble is, I think the thing that's exacerbated it is because we've had them inside for a while and now on the track. And until just the last 2 weeks, we haven't had them on any grass.
No.
His diet has been relatively low in water, effectively.
Less water content.
So eating hay, eating straw. And I think that's probably just what has exacerbated the urinary side of things. So hopefully now they're on a bit of grass. So the paddocks that haven't had anything on for almost 12 months, and Buttons who had the Yonas previously hadn't been on them.
No.
We're letting the goats back onto those.
So you should be.
And that's like a micro rotation. So they're only on the grass for a week, and then they're on to the next paddock for a week, and then the next paddock for a week.
It's so complicated, everything that goes on like behind the scenes.
Mm-hmm.
Mickey's been with me for a holiday.
Yeah, Mickey's had his holiday. I think he's probably sad. Yeah, I left him here the other night, didn't I?
We do like to say that we're always everybody's rubbish sort of thing, that at some points there's always something that happens, and yours was the other night where you forgot Mickey.
I left him here. Got home. Well, I'd stayed late anyway on a meeting with Ollie from the Meraki project.
And you'd had a long op that day.
Yeah, big operation that day. What was that? Was the tortoise? Yeah. Okay, yeah. So I was meant to start at 12, so I'd come in at 9 anyway to do that, and then got home, sat down, made a cup of tea, realised I left Mickey here, and I was like, I don't know, 10 o'clock or something. Right, so I don't know what time it is, but it's late at night. Thought I'd share my everybody's rubbish moment for the day. So came into work earlier than what I was meant to this morning. Really complicated surgery, and then I stayed at work later than I was meant to this evening for a meeting. And then went home, got home, sat down, made myself a cup of tea, and realised that I forgot to take Mickey home from work. Mickey! Oh, Mickey! Oh dear! You got trapped. So poor Mickey has probably been sat here all day looking forward to going home, and then all the lights got turned off and you're on your own. Don't worry, I've come back for you. I've come back. Yeah. Should we get you home? Come on then, Mickey. You're looking forward to going home? Yes. Just don't lick my face. You lick your bum. I don't even lick in my face.
Still don't think it's as bad as mine now. Mine was the hedgehog that... It was a really busy Saturday morning, and the rescue were coming to pick the hedgehog up, so I thought I'd go on and put it in the bag, and the bag wasn't... There was another bit that wasn't zipped up properly on the bag, so I'd zipped up the main bit, but there was another bit that the person... You put the hedgehog ready to go. Yeah, I put the hedgehog ready to go, thinking I'll be hyper-organised, I can just hand over the hedgehog. So I handed over the bag. They got back to Bodnam, realised there was no hedgehog in the bag. So we had to go on a hedgehog hunt, and we'd just bought a new fridge, hadn't we? And we'd unpackaged it, but it was just... No, we hadn't unpackaged it. It's just there was a bit at the bottom that was open from the cardboard. So the hedgehog had got out of the bag, off the side, through the prep room. Yeah, it's obviously been wandering around prep room, and none of us had seen it. And we were all, here working.
Because we were here working, yeah.
And it had got in behind the fridge, so then we had to work out how to get the rolled up hedgehog out of the fridge.
There's like stuff behind the grill. There's like a grill at the back of the fridge.
And all the pipes and everything, and it was wedged, wasn't it?
Yeah.
And you just feel so bad and just so stupid that you've sent them with a bag with no hedgehog in it. But it's all well-meaning, and we're trying to, it just happens, doesn't it?
I think they saw the funny side as well.
Yeah.
What about that time I dispensed a pot of medication? And we double-signed it, so I dispensed a pot of liquid antibiotics for someone with a pigeon. And they got home and called us because they'd been trying to suck stuff out of the pot, and they weren't sure whether we just put a tiny bit in there. It turned out that
you hadn't put it in.
I hadn't put it in.
But also, we double sign everything. So you'd obviously showed someone the bottle you'd taken it out of and shown them the packet.
Yeah.
And
there was nothing in it.
No.
Yeah, that was embarrassing.
Fortunately, it's rare, but when we do it, it's always something crazy. But yeah, Mickey had a nice week. He gets on really well with the cat. So I was a bit worried because we've got Sarabi, the cat that hasn't met him yet. And within 20 minutes, they were sniffing each other, and within 2 hours, he was just cleaning her head.
He's very good, isn't he?
He's so good.
He's no problem.
No, he just picks up on other animals' behaviour. It doesn't matter what species it is. He just picks up and knows whether he should be still or... Yeah. He knows with Belle, my other cat, that some days she really wants to play and wants to, cuddle or lick him or sniff him, and another day she's just in a bad mood, and so he knows, and he'll just go and stand by her and he'll stay really still because he doesn't know if he's going to get whacked or if he can carry on. But yeah, he just picks up on it with the chickens as well. He just knows not to go too close, and he knows if they're getting upset, and he gets back. It's weird.
Unless it's Chicky, he hates Chicky.
Oh yeah,
Chicky attacks him.
Scary.
So.
And my chickens did attack him once, but they were different chickens, and he realised they were different chickens.
Yeah. Him and Chicky have Not a love-hate relationship, it's just hate relationship.
Oh, he does have a weird thing though, because you've taught him to find hedgehogs in the garden.
Yeah.
And I'll have
out of the garden at home.
Well,
not just to locate them.
Yeah, just to locate them, not to hurt them, just so you know where the hedgehogs are. Yeah. And this is the second time he's done it now, when he's been staying with me. Windows are closed. Our bedroom's at the front of the house, and he's in a crate in the bedroom. And just in the middle of the night, he'll wake me up whining as if he needs the toilet. And I take him outside and he just shows me a hedgehog. And then he wants to go back in. And all he wanted was but how does he know that a hedgehog is there? Did
you reward him when he showed you the hedgehog? No. Pretend he's a good boy.
No. The first time I was completely confused because I was sure that he just needed the toilet. So I got it really quickly to get him out because sometimes he has his bum problems. And he just wanted, that was right at the bottom of the garden, and that just really confused me because I kept saying, leave the hedgehog alone, Mickey, just go to the toilet. But this time he literally showed me the hedgehog, he sat by it, and then wandered back inside. But I just don't know, he can't smell it because the back windows are closed. He must hear it, I don't know how. He just knows it's there. And we'd been asleep for like an hour and a half. So we hadn't been out in the garden recently either. No. He's odd. Magic. But yeah, so that's the only bad side about having him. Is he wakes you up to show you a hedgehog. No, we think we've got baby hedgehogs because the food's been going down in the daytime as well as at night. So Joe's putting hedgehog food out twice a day now. So we think we've got a pregnant mum there because we put it in the greenhouse where the cats can't get it. There's just a little hole it's a vent that's small enough for a hedgehog to get through. So. Yeah. You have to
be careful and end up like I did feeding the birds a few years ago when we were doing like a 12-kilogram bag of bird food a week and a whole like bucket of fat pools a week.
Well, we were using that Wainwright's insect food, the kitten, the cat one, and that was £15 a bag. But now I've realised Pets at Home are selling a 2-kilo bag of hedgehog food that's $4.99, so they're onto that now. It's much cheaper and I get a discount on that. So not so bad.
I tried some of that insect Wainwright's food with the jackdaws actually because I thought that'd be better than the kitten biscuits that Jack and the jackdaws have, but they didn't like it.
Didn't they?
No, they weren't interested. But it's quite dry.
Yeah, it is dry.
Whereas the specific kitten foods only have like the best quality.
Yeah, it's got the oil food on the outside.
Yeah, it's quite oily.
Yeah.
They quite like that.
It's mad what we do. Because Bao liked that insect food for about a week and then she went off it and that's when we started feeding it to the hedgehogs and they loved it.
Yeah,
so. But they really like the Pets at Home one as well. So. And it's much cheaper.
You've done like a survey. They've got a little tick box next to their bowl, like which one do you prefer?
What Joe's like.
Would you recommend this establishment?
Yeah, would you have this? But yeah, it's nice to have them in the garden. I think we've got about 3 now that come. Oh, I can't wait if they bring the babies to go and eat. That'd be really cute. Yeah, we should.
You should get one of those little.
Yeah, that would be good.
They're the ones
like a trail cam.
I use. Just the ones I use for the when the goats are kidding. Because it's probably not that far from your house, is it?
No, it's about, I don't know, like 30 metres or something, maybe?
You might find the Wi-Fi reaches. Test it on your phone, see if the Wi-Fi reaches down there.
Oh, yeah, and if it does, I could just get one of those.
Just get a camera.
That would be really cool.
Because then you can have the app on your phone and just log in and look at it.
We're waking up in the night.
Yeah, you will, yeah.
Can you imagine how mad Mickey would go if there was a load of baby hedgehogs in the garden? Oh, man. So I suppose that's and then I've had Artie in this week, who's my other cat. So I've got Artie, Belle and Sarabi. And Artie, I think a few weeks after I first had him, came in, didn't he, for diarrhea and he was on a drip. And he does this weird thing where his third eyelid goes across or his eyes go squinty. And we've worked out it's every time he's got a bit of an upset tummy and we worked out he's got an overgrowth of a type of bacteria in his gut, which is normally from having too much protein. And he does go and feed at some of the neighbours' houses as well. And Sunday seems to be worse, which I think is when some meat is put out. And then so he hasn't been bad since that though.
No.
But he was just so quiet, but all his bloods were normal and he was on a drip for 12 hours and then he seems fine now. Yesterday, Joe messaged me about 5 o'clock just before we finished saying he was still quiet and sleepy and so I need to bring some medication home for him. And then within an hour, I was just drawing up the meds, wasn't I, before we went? And then I get a message saying, oh, no, he's fine now. He's just completely perked up and he's outside. And, he ate last night. He's eaten all his food this morning quicker than he has been eating it for a long time. So I think it has been building up. And then, I don't know.
Well,
they're a
it's
pain.
good that he's doing well.
Yeah. The worry is that we know he's got that coronavirus, don't we? Or that he has had it before.
Yes, yeah.
Which can turn into FIP, which we've lost a cat from before. Yeah. But I just keep telling myself I don't need to worry as much now because there is a treatment for it now, which there wasn't before. Yeah. And normally, after the age of 3, the risk reduces, doesn't it? So Belle's past that now, but Art is just coming up to. But yeah, he's fine this morning, as if nothing's happened.
Good.
Pain.
Yeah, well, that's animals, isn't it?
Yeah. But. And then we've just had a pain with Sarabi because she does chase the chickens. She doesn't do anything like to hurt them, but she just thinks it's really fun to chase them, which Artie will do now and again. He'll jump out of a hedge as if he just likes to shock them, whereas she will actually give chase to them. And they've ended up on top of the greenhouse a few times because she's chased them. So we have to keep her in the day now when they're out, and then we've started letting her out at night. So luckily we've got a cat flap where we can... But each day I have to remember to unlock the cat flap, lock the cat.
You need to borrow my ducky boys and Chicky for a couple of weeks.
Yeah, ducky.
The ducks would chase her around. She would be scared of the ducks, for sure. They're really aggressive at the moment.
She's a
They chase Fern around the garden. They chase the rabbits. They chase the guinea pigs. They chase Sparky. Tarka doesn't go in the garden because they chase him.
They're so bossy. See, when we had Squirrel, the other chicken, she was savage. She's one of the ones that attacked Mickey that one time. All 3 of them jumped on him. And yeah, the cats would not go down that bit of the garden. We've got it fenced off so it's separate, but Sarabi ignores that and goes around and over the fence. Yeah. But yeah, the other cats would give them a wide berth, but these 2 are just a bit dopey. Yeah. And one of them's been broody for about 3.5 weeks now. Nearly 4 weeks, I'd say. Yeah.
That's not a bad thing.
But I had them from Anna, and Anna said hers are exactly the same.
Biologically, it's better for them to have a broody period and a break from laying. So.
Yeah, and that's what I was saying. All the other chickens we've had problems with like reproductive issues, haven't we? And egg peritonitis. These 2 are 4. I should touch wood, but they're 4 now, and we haven't had any reproductive problems apart from them being broody.
But you just got to put up with them being boring.
Yeah, they're just boring. Squirrel was great. She was such a character. She just sorted everyone out. She was like always looking for treats and like if you dig the garden, she'd be right there waiting for worms and stuff. Whereas these 2 are just like, they're not bothered. They like grapes. That's about it. But no, they're cool, and we do get a lot of eggs off them, so that's nice. And they are pretty. They're prettier than the other ones.
Yeah, let's get some photos of them to put on YouTube.
Oh yeah, I'll get some. I haven't got any photos up to date because Patty's already. She's just sat in the box all day long. Yeah.
So what else we got to talk about soon?
Maybe about the big surgeries. So we've had quite a run of big surgeries, haven't we?
Yeah, it's been quite a lot. So Friday we had a patient. He's had a medical workup, so had blood samples. He just wasn't quite right actually. So it was an interesting start to it in that his owner brought him in just being like, well, I think he's okay, but something's just not quite right. Yeah. And he's had just a couple of episodes where he's been wobbly.
And they just know him so well, don't they?
Yeah, but in other respects was all right. So did a blood sample and he had a slightly low blood sugar level on the blood sample, which is not unusual when you sent it out to the lab to be analysed. But we thought we'd better check it. And when we checked it like at patient side with a monitor, it was still low. So he's a breed that can get something called an insulinoma, so a tumour that produces too much insulin. And too much insulin means that the body can't regulate its blood sugar level. And the blood sugar level becomes incredibly low. And
it was mainly when he was on walks and things, wasn't it? So it was when he was burning off the glucose. It just took him too far over.
Yeah. So we diagnosed an insulinoma. He had a scan with Mark, who comes and does some of the specialist ultrasound
wire referrals.
Yeah, wire vet referrals. So Mark could see that there was a tumour.
That's amazing. And he could see the size of it.
Yeah, so we knew it was about a centimetre or so. Although I expressed to the owner before doing the surgery that insulinomas are notorious for being difficult to find surgically because they can be very small. So although I was confident in Mark's scan, just want to be open-minded, they might not be straightforward. But we knew that it was what Mark could see was in the body of the pancreas, which is the most difficult bit of the pancreas to access.
Typically.
So we went in surgically on Friday. So I discussed with the owner that we had options, so we could refer for like further CT scanning and stuff like that, and then specialist surgery, or we go in here.
Yeah.
And I've got my surgical certificate and like fiddly things, and we'll see if we can find it.
Yeah.
But the complicated thing is the aftercare.
Yeah, which is what we've really had to
turned out
plan
surgery
for.
was also complicated. Yes. It turned out. But I was expecting the aftercare to be complicated because you're taking a patient who has too much insulin and you're removing that source of insulin.
Yeah, so the body isn't used to making its own insulin.
No, exactly. So the rest of the pancreas, which normally produces insulin, has shut down.
And it's got to suddenly start up again. And at the same time, you've damaged it and made it angry.
I effectively cut off about a third to a half of the pancreas.
Yeah.
Which pancreatitis, so inflammation of the pancreas. There might be some people listening that are familiar with it in humans. In humans,
they say it's one of the
really
most painful conditions that you can have.
And it's something we see very commonly in dogs as well.
Yeah.
And so we knew that we'd have to manage a pancreatitis afterwards, just didn't know how bad that would be. And we knew that either we'd turn him into an uncontrolled diabetic, like at the flick of a switch, or more worst case scenario is that actually we might remove that tumour, but if it's already spread, then his insulin levels would remain high and he'd still have a low blood sugar level. But then we'd have the pancreatitis and surgery to manage. Or it might restabilise.
Yeah.
So he's somewhere between the restabilising and the diabetic. And it was pretty stable, but his blood sugar level was slightly higher than where it should be. So you
slept with him overnight here?
Yeah, so I slept here overnight on Friday night.
And kept checking his blood glucose levels. And it went up, didn't go above 13, did it?
No, it came up to 12.5-ish or something.
Yeah.
It was highest. So it should be somewhere less than like 7 or 8.
Yeah, and then yesterday it was just slowly coming down through the day, and I think it was about 11 before we went home.
Yeah.
So yes, we were happy with that we didn't have to give him any extra insulin.
No, and he was comfortable and managed to get him off his methadone and things.
Yeah.
So.
He had a bit of a eventful recovery because he just...
He's a bit of an idiot
he is crazy, and we were saying as well because his blood sugar level's high as well, and he was dysphoric because of all the drugs that he'd had.
He had a ketamine concentrate infusion, so ketamine drip, and a methadone drip, which is equivalent of morphine.
Yeah,
and all the other drugs as well. And
so then it's us nursing wise working out: is he painful or is he just sort of out of it, or is he just being silly?
Mm-hmm.
And so it was about 2 hours, there was 1 or 2 nurses sat with him, because also he just wanted to put his head on you like constantly and be cuddled up, but at the same time, to start with, for about 20 minutes he just wanted to scream at the same time. So we were taking it in turns to sit with him. And that was hard, because then you'd take one drug away, put an extra drug. We were just trying to balance it out, weren't we?
Yeah.
And it was so funny at the point where he did actually relax, and we had to get Abby out, our student nurse, out from under him and just sneak away, like leaving a little baby that you didn't want to wake up. And then we got out the door and everyone was going, yes, he's asleep.
And then he was pretty good overnight.
Yeah, and he was good yesterday.
And then it was just fiddling around with medication. I had to start him on a different infusion, something called metoclopramide, which, because he was starting to get a bit nauseous, probably because of the pancreatitis in the morning, despite the anti-nausea drugs he already had on board. So, but no, fingers crossed. Yeah. We discharged him yesterday.
And he's coming to see me at 12 o'clock today.
Yeah, he's coming today to hook his cannula out.
And we've placed a feed-in tube, so if he does get too nauseous because of the pancreatitis, we can still feed him.
So he's got a plastic tube in the side of his neck that goes down to his esophagus, the food pipe.
And then that means even if he doesn't want to eat anything, we can still put the medication, or the owner can still put medication, so he can still be at home. Yeah. So we've just planned for every event, really.
Yes, yeah. There's no point doing a big surgery like that and then not managing to do the aftercare afterwards, because the aftercare is as important, if not more important, than the surgery. But
yeah, you started eating yesterday, didn't you? Because you'd slept over the night, so you went to Morrison's to go and get breakfast, and then decided not to have a cooked breakfast, but to buy a rotisserie chicken. So
well, that wasn't the only reason. So I was going to buy some chicken for Woody anyway. You could only buy like the cooked chicken in the little plastic trays, and the plastic trays like.
Yeah, they're tiny.
Well, no, it's quite big, but with only like a third of it full of chicken.
Yeah.
I don't want to spend all that money on all that plastic. And I worked out 2 plastic trays was going to be almost the same cost as an entire like roast chicken. So I thought, I'll just buy the roast chicken. And then rather than having a cooked breakfast myself, I just had some porridge oats and some roast chicken.
It did smell nice.
It was really good.
Yeah, by about
So it's best rich
by
chicken
10,
I've
11
had.
o'clock in the morning, he'd eaten a piece of chicken, hadn't he? And then after that, he started eating the chicken mixed in with the low-fat dog food. So we did have to give him just one little tube feed early on, didn't we? Because we worried if it was like acid reflux because he hadn't eaten for 24 hours. But it's weighing up because we didn't want to feed him too much, A, because of his pancreas, because the more the stomach fills, that tells the pancreas to release more enzymes. So you don't want him to have a full stomach. And you don't want the pancreas to need to produce those enzymes. So we don't want to feed him too much. And then also we didn't want to feed him because then his blood glucose levels would go up, which is also not what we wanted. So it's trying to get that balance, isn't it?
Yes, yeah. So it's quite intensive.
Yeah.
But fingers crossed. Everything, I've said to the owner several times, he's not out of the woods at all.
No.
But,
and I said that and then I was like, oh, his name's Woody. And then they think you're making a pun. But what else can you say?
but yes, no, he's hopefully on the mend, so we shall see. Yeah. So that was a big op. I think he was under GA for 3 hours or so. I think.
Yeah, because we were thinking the surgery would be the easy part of it, really.
Yeah, but it was right at the body of the pancreas, but also relatively large, very close to the blood vessels supplying it.
And he's deep-chested, isn't he? So it was a long way in.
And I ended up removing about 2/3 of the pancreas to achieve a margin of tissue around it as much as I could to give us the best chance of getting rid of it all.
But it worked out well for Meg, our student nurse, because she needed to scrub into a case. And so far, she's been just sort of passing things for routine. So to be involved in a nice big
so she had to hold all his guts out of the way, essentially. Because
Because
although I've got retractors for that, sometimes there's nothing that's quite the same as...
Yeah, because I think you had two different retractors on him. And then Meg was the third retractor. Yeah.
So, no, that was good. And the day before that was the tortoise spay.
That was amazing.
So, which is the first... Well, Woody was the first insulinoma that I've done.
Yeah.
Tortoise spay was the first.
Because we've had a few tortoise spays booked in, and then either they've been too ill or the owners have decided not to put them through it, haven't they? And this is the first one.
Yeah. So...
But little Zippy, she was...
Yeah, she was a star patient as well. Yeah. So, but that was interesting and slightly fraught. So you have to cut a hole in the bottom of the tortoise.
Like a little trapdoor.
Yeah, in just the right place, because otherwise you might incise the heart, or you might incise the pelvis, or the scapula, or something.
Yeah, if you need to get the saw. So we use an oscillating... Do you use the oscillating saw for it? Yeah.
Surgical.
But then you've got all those organs just underneath. Yeah. And you need to make it the right shape so then it will go back in tidily after. Because you basically place the square of shell you've taken out back in.
So it's the carapace is the bit under... No, plastron. Oh, I don't know. It's the bit underneath. I'm too tired.
Too many ops.
So you cut like a rectangular shape out and try and bevel the edges a bit so that it sits back in without falling back into the tortoise. But it's interesting because you cut that bit of bone out and I maintain the attachments underneath to one edge. So you like flap it like a trapdoor.
You have to keep it back.
But then actually that bone will probably die anyway, but it will form like a plaster essentially. Yeah. And the tortoise's body will lay new bone underneath to form a seal.
So at some point will that push out?
It might all come away.
Wow.
Yeah, it might all come away at some point. Or if there's like, I don't know, bad smell or something like that, I might have to remove it.
So I think that's the thing behind the scenes of all these ops. It's not just doing the op. We've had to hunt around to try and find the best thing to stick that shell back together, which turned out to be a bone cement that they use in hip surgery. And it's just all these things where we have to find,
so we use some bone cement and then use some of the epoxy putty on the outside then to hold it. But the challenge was actually the follicles were big, bigger than what I was expecting. We had scanned things, so I knew that they were large, but so we had to. So the other interesting thing is reptiles, if they're a suitable plane of anaesthesia, so if they're properly asleep to do the surgery, they don't breathe.
Yeah.
So we had Becky deep breathing every 15 seconds or so.
For the whole operation.
We have got a ventilator.
It's on the way, yeah.
Finally biting the bullet and ordering one after 8 years.
Yeah. Well, we were all a bit scared of using one as well because it's not anything... We've all done it a few times, but not... But then I've had training now on that when I went to the exotic nursing conference. So hopefully when it comes... And Burton's assured me that it's a nice, easy one to use. And it did seem like it. I've got my notes.
I'm sure it'll be fine.
I think it will be.
But yeah, so Becky was doing a breath every 15 seconds using the anaesthetic machine and circuit. But... Well, what I figured out during the surgery, because I was struggling to get the follicles, the ovaries out, So we realised we had to synchronise me gently lifting them. Because bearing in mind it's egg yolks.
Yeah,
so
you
the
don't
last
want to
thing was
burst
if you
them.
burst them, then you've got a really high risk of infection and complications. So I had to gently lift them at the same time that Becky would do a breath to then fill the lungs to help push them up a bit. So, yeah.
And then we ended up
It felt like
using
we were in
our
like a maternity ward.
Yeah, it was.
Breathe.
Breathe. And then we used
Well,
the
like
sterilised teaspoon, which
Yeah,
we
we
have for
got
all
the teaspoon
sorts
out.
of occasions. It's normally bladder stone removal, isn't it? But we've
Yeah.
used it for lots of different things.
Including tortoise spay.
Yeah.
So.
It's-
Yeah, but no, it all went okay. She
Yeah.
did, her heart stopped for a bit. That was
But by the
slightly-
time I'd got the adrenaline,
Yeah,
then
it
she'd
started.
started again.
And
So-
reptiles are hardcore anyway. But yeah, her heart was just beat, beat, beat. And then just stopped for about, I don't know, a minute,
Yeah.
2 minutes maybe.
Because I was in there by the time, I got the adrenaline. Yeah.
And then it just started again and carried on
Yeah.
the rest of the procedure.
And then we left
And
the
was
adrenaline
fine.
on the tray just in case.
Just in case, yeah.
So we didn't jinx ourselves. And she came round brilliantly, didn't she?
Yeah, she was eating the following morning.
Yeah.
Eating by 5 o'clock in the morning
Yeah.
the following morning.
And I
think.
saw her yesterday for a post-op check and took her dressing off and everything was all nice and hard under the shell now.
Yeah.
And she'd been eating... She started with just blueberries because that's her favourite and then she was having cucumber and her tortoise pellets as well. So.
Yeah, yeah.
She hissed at me and she did a big wee in her box yesterday as well when she
Good.
came in. So, yeah.
And I guess worth noting that I'd covered extensively with the owners beforehand the husbandry side of things and diet as well. Because there's some things that at the moment she's okay 2 weeks, it's post-op, we just want her eating. But going forwards, we've talked about what to feed her.
Yeah.
She's very well loved, she's very well cared for.
Yeah.
And I guess that something like this, actually, the follicular stasis, which we're dealing with, is probably one of the few conditions that we see in reptiles which needs treatment, which isn't because they're poorly looked after.
No.
If anything, it's because they're too well looked after.
That they're able to produce
that they're able to produce all these follicles because they feel like they should breed, but then the conditions aren't quite right to follow that through with the breeding, or there's no male stimulus
there's no male around
to prompt them to turn into eggs rather than follicles.
And the thing with the tortoise is that if you've got a bearded dragon with it, their skin is soft and they can fill out their abdomen, whereas the tortoise has got nowhere to go. Yeah. So we were amazed, weren't we, that she was eating pre-op as well, wasn't she?
And actually, one of the signs that you have got follicular stasis is they just become generally weak.
Yeah.
So like unable to hold themselves up on their tippy toes.
Yeah.
And I think that is just because they can't quite use their legs properly because there's not enough space inside.
And the owner said she was using her front legs again now and walking around well. So bless her.
Yeah, really fascinating case. But I was reflecting on this actually because I think we talked about the veterinary side of things before and looking after new graduates and that sort of stuff. And it's interesting in that I often, when I do things like this, so bearing in mind the tortoise spay, the insulinoma surgeries that I've not done before, we had a complicated surgery carried out here the week before as well on another patient.
Yeah.
So there was an airway surgery, which I could do and I have been shown how to do it, but actually is one that at the moment I would consider in that patient was probably better to have a specialist surgeon come in and do it.
But it was a bit far for him. If he was going to go for referral, he doesn't enjoy going in the car.
Well, he would have died.
Yeah,
because
he would have just been too stressed.
Very traumatic.
Yeah. So it needed to be here.
But yeah, so I think I was thinking about I need to chat to Beth, our current new graduate, it's a good thing to reflect on because there's situations like this that, for example, if I was to say to Beth, okay, goodbye, I'm leaving for the day, like you're on your own, and if there were something like a foreign body surgery come in, so something stuck in a dog's gut, and for me to say, no, don't worry, you can do that, that wouldn't be deemed acceptable.
No.
Would it? It just wouldn't.
No.
Even though I'm sitting here knowing that
she could
because
do it.
the surgery
Technically,
she could do it, and I would be very comfortable and confident that she could do it. And
the thing I always think is, would I let her do that on my animal? And I would.
I agree.
But I'd be there. She'd need cheerleading and just be like, "Yeah, you've got this." But that would be better if you were there rather than me being there because I'm.
But again, it wouldn't be acceptable. But then the trouble is that then there's surgeries like the insulinoma removal and like the tortoise spay, which I'd not done before and didn't have anyone to supervise me. Yes, I have had surgical and exotic training, but in the same way that Beth has had 5 years of vet school training and then surgical training from me. And it just makes me reflect on the gradual skills loss that we see in general practice because there'd be many other vets out there similar position to me that wouldn't do those surgeries because they wouldn't feel comfortable doing them without the accepted norm of having someone there
and it is the
to
mental
teach and
side
to mentor
of it,
and to educate. Because for me, both surgeries were incredibly stressful. Both of them, very, very stressful. And both of them moments of me being in the position of, should I be doing this?
Yeah.
But feeling confident that I have the skill set to do it and I have the knowledge. But still, there's always that bit of you that thinks, well, should it be someone else that does it?
And especially if it doesn't go as you expect, like with the pancreas, it was slightly more than you had to take, and then you think,
if I'd have known what it was going to be like beforehand, it's one of the situations that you would definitely double.
But you've got all those years behind you, whereas Beth hasn't. So if something was to go wrong, it's so easy to blame yourself afterwards as well.
I think this is the difference, is that it's more actually is what matters is the years of developing reflective processes and the ability to deal with that pressure and have those drains to allow you to deal with it whilst being comfortable and confident in your own skill set. Yeah. I think it's more that rather than the actual technical skill. And
I think it's having the team here as well, because say when we've had situations where we've had to do CPR and maybe we've lost a patient, we all do stand around and talk about it after and be like, no, we've done this and this. Oh yeah, we could have done that a little bit better. And we are quite open. So someone wouldn't just be left on their own if something went wrong to think, oh, what did I do? We do actually stand around and chat and say, oh no, actually, we did everything that would have happened no matter what. And I think that definitely helps afterwards.
But then, to go back to these procedures, I think unfortunately, there's probably lots of other places out there where it wouldn't get done, or it would get referred, and then there's patients that it would be outside of their ability to be referred because they wouldn't be able to afford the referral. Well, and
as the nursing team would have missed out on all that experience. Like we've spent the week before Woody discussing feeding tubes, discussing which diets, discussing how the pancreas works, and discussing pain relief options, and all of that that could be put down as CPD really, and all of that would be missed. And I think everyone, on the day it's always a little bit stressful, but afterwards you think, like yesterday.
Well, I think it's predominantly stressful for me, I would say.
Not when Woody was going.
No, I was going to say the recovery bit when he's screaming and thrashing around.
Yeah.
But as in, it was not a stressful atmosphere.
No. Just everyone worries about their own little sort of bits, don't you? Just always have that little bit of like, oh, how is it going to go, and are we all up to this? Because it would normally be referred, and you just, like you said, it's just that bit of doubt, isn't it? And then afterwards, like yesterday,
it necessarily normally would be referred. It's more that it's becoming normal that it would be referred.
Yes.
Which for me, I don't think is appropriate. No. And I said to Woody's owners, like, you can go for referral, or we can do it here, and we discussed the pros and cons and the differences. And
he said to me yesterday, I think he's been much more relaxed here because he knows you all, because he comes in for monthly injections.
In once a month,
He just knows us all already, so and we know him, and we know his quirks, and we know we knew he might be fussy with his food
in the middle of the night, 3:30 a.m. he ripped out both his intravenous cannulas, so 2 in, ripped out both, and I just sat there and put one in. I put them as long because it's middle of the night, and I can't risk it. Just in case. But he was good as well.
And then yesterday afternoon he was letting me take his blood glucose from his leg.
And on my own. Yeah, and I did that throughout the night as well. So, whereas it's that relationship that wouldn't be replicated elsewhere.
And then I think the owner is a big surgery.
I don't think Woody likes me. But he never has liked me.
Apart from when I tried to offer him the light food and you'd already given him a piece of chicken, and he just looked at you as if like, you've got chicken, she's offering me that. But and I think for the owner, they know us, they know, they trust us, and I think that takes a weight off as well. I can't wait to see him this afternoon. And then people that work,
he'll keep me awake. Well, him and Zippy will keep me awake. Not keep me awake because I sleep pretty well.
But it's just what you think before you go to sleep.
Yeah, it's those things that I'll be thinking. Oh, I hope they're doing all right for a few weeks now. Well, Zippy probably for 6 or 8 weeks realistically. But Woody the next couple of weeks.
Yeah, and it does really bring us together as a team as well, because we had people who weren't working yesterday messaging, oh, how's Woody doing, what's he up to, and it does just, it's nice. Yep,
so, fingers crossed he'll do okay. But
that's our 3 big ops if it comes in 3s for a little while.
So Diff has not been quite so straightforward, the airway surgery, but hopefully he'll be on the mend. Yeah, I've had quite a run of it actually. We were going to have a rata orthopaedic surgeries next week, but the client decided they didn't want to go ahead, so we're not doing that now, which is fine.
And that's it. It's nice having Rata there as well, isn't it? To either ask for advice or to come in and actually
so they did so it was a laryngeal tie-back surgery was the third one that we haven't discussed in any detail, but that's when the voice box becomes paralysed. So when the voice box is paralysed, the vocal cords, instead of normally being held out of the way, they flop down into the airway and block it, essentially. Yeah. So if the dog is calm and very relaxed, they can breathe enough. Can cope. But as soon as they get either anxious or start panting, they can't thermoregulate. And
the weather's been warmer, hasn't it, recently?
So, so he'd had a couple of episodes of respiratory collapse, like near-death type collapse. So hopefully he will be okay.
And he was another one where you slept here overnight just
to make
sure.
Yeah, slept here overnight post-op with him because there's a risk of it failing afterwards. Although, to be fair, he just slept and I just slept. I didn't bother giving him any medication. I was like, well, if he's sleeping, I'm not going to wake him up and medicate him. He's comfortable. Yeah, don't want to disturb him. Woody was less settled than that. But.
Yeah, although yesterday he was due for another dose of methadone, wasn't he, Woody? And then we kept testing him and checking, and he was really fine. Comfortable. Yeah. So exactly. Yeah, it just depends on the dog, doesn't it?
Yeah, it does.
So it's been nice. It means that my admin work has just gone out of the window. The last week I've really done, and then it's just catching up on that. And I've been doing my project management module on my VMG course. And then it's going through things like, because what I'm doing is we're upgrading our exotics ward, aren't we, to try and make it have room for an incubator for our exotic patients, but also a little bit of office space and some storage. And the bit that I've been learning about is how to plan it, and it's things like Gantt charts where you plan out each week and exactly what's going to happen at what time. And I'm like, that doesn't allow for tortoise space and insulinoma removals and members of the team being off sick or worried about something and we need to have a chat, or doing rotas, or then my dad saying he's going on holiday so he's not going to put the shelves up the week we thought he was going to do it, and then he comes the week after. So I'm going for an agile approach, which is where you do a little bit, then you reassess, and then you do it, and it's more flexible. Okay. That's the approach we're taking.
Real world approach.
Yeah, that's the one we're taking.
It must be like that with the project at Wildside, actually.
Yeah.
I'm probably going back down there tomorrow morning to take some stuff, so be interesting to see how Lindsay's getting on, and Aid and the team making the clinic.
Yeah.
Still trying to get the X-ray stuff pinned down, so I've just not had the brain space or time for its last 2 weeks or so. So I need to get back on track with that, really. Because
cases like that you have to look after those first and plan for those first, and it's just working out what order
research
to do everything in, isn't it? Yeah.
So hopefully it'll be another update on Wildside. I know Lindsay's got some marmosets lined up that she feels will need vasectomising, and I think a Savannah cat that needs a health check and probably neutering as well. Something like that.
But it's going to be just so cool.
So watch this space, because we're supposed to be taking on that work. Well, originally the deadline was the end of this month.
Yeah.
So end of June. So recording currently June 7th,
8th today. Yeah.
Yeah, 8th of June. Another 2 or 3 weeks or so, then we should be doing that.
Oh, and I learnt so much at the Exotic Vet Nurse Conference. It was just amazing.
Although, I trumped that with ChatGPT though. So downloaded ChatGPT finally, even though being really, I wouldn't say I'm hot on AI, but I'm very interested in AI.
Yeah.
I was listening to a podcast, it's the Diary of a CEO, all about AI, and thought, I just need to buy the book and download it. So I did it and asked it how to anaesthetise gibbons and mountain lion stuff, and it gave me what seems like logical answers. So.
Whereas what I used it for was to see what my cats would look like as humans.
Yeah, exactly. Then also, so what's even more interesting actually, which I haven't yet had a go at, but I need to, I have downloaded it, is an app that allows you to verbally tell it what you want to create.
Yeah.
And it will create another app for you. So rather than having to code it and go through all of that process, which I would have absolutely no idea how to do. So I could say, can you make me an app that will record...
my anaesthetic or something like that?
Yeah.
Wow.
Yeah. But then you could sell that as well. So there's people that do that, and then we'll market the things they created and sell it. But anyway, so I was thinking with things like maybe with Wildside, like keeping patient notes and anesthesia and things, but maybe with my own animals, with like recording weights. And
those quality of life forms and things like that you were talking about.
Yeah,
that would be good.
So essentially, the scope is what you can imagine.
Yeah.
That's like the crazy thing.
Shall I show you the Recover app? Because you weren't in my CPR training. So every year we try and do
CPR
training.
Weird breathing noise.
Yeah, shall I get it? It's really funny.
So the rest of the team are just telling me that apparently it's just got a really creepy breathing noise.
It's really creepy, but I think it will be useful.
Is it especially for veterinary, or is it a human one?
Well, I don't know. It's because it goes by the Recover guidelines, which is the animal side of things.
Okay.
So I went to BSAVA Congress and went on the updated Recover guidelines, which tells us how to do CPR, what drugs to use and things. And it's all really simplified. It used to be quite complicated, didn't it? And it is, it's much better. But so then I brought that back and went through with the student nurses, and then we did a team one on Friday, but you were doing Woody.
To be fair, I think the reason they've simplified is they've realised that most animals just die anyway.
Yeah, they have, and they've actually put all studies together. There's a guide now, and they've put all studies together for each of the things we used to do, and realised it doesn't have a better outcome. This is the app. So that's your heartbeat when you should be doing your compressions, and then that's your breath every 6 seconds.
Why does it not have the like staying alive song? Or like that's what it used to do.
But it's actually really useful. Apart from mine doesn't, unless I close the whole everything down, it doesn't stop. It just keeps going on my phone. But it's really useful because it counts down your 2 minutes for when you're meant to swap between people. It tells you how many cycles you've done, and as soon you don't have to do anything. You just press the app and it opens and starts straight away. So everyone's got that now for free.
Well, I don't. Maybe I should.
Yeah.
But if we had a dog crash under GA.
Yeah.
3 weeks
because
ago.
We were planning, because Meg needed to sign it off on a CSL, which is like a vet nursing training log. But then actually we had a real life situation that she was involved with, so she's only had to do one practice.
Do you know we've got that dog booked back in?
I know, for
the rest of its
dental.
teeth.
I feel like we're ready though this time. And its teeth were awful. They do need
doing
they?
But it's like like a 14-year-old terrier.
Bless it. And it came round as if
nothing had happened. It literally died. The heart stopped for quite some time, and breathing had stopped. And
I was like, hang on a minute, I've got to get all my notes. But luckily I had everything printed off, step by step, for what we did. I feel like we did everything. Yeah, we did. Yeah, I went through it, didn't I? We must have been about 4 or 5 minutes in, because obviously I didn't go to get my notes straight away.
No.
We got started with compressions and stuff, and we had done everything. The only thing was different was the adrenaline dose, wasn't it? It's lower now than it used to be.
Yeah,
so
we reversed as many of the drugs as we could do.
Yeah.
Gave adrenaline, gave lidocaine, which is because what had happened is she developed a heart block.
Yes.
But initially, I could only stop the heart rather than stop the heart block as such. So we had a couple of times where we had to effectively stop the heart completely with the drugs, and then it restarted, and then we'd go back into this heart block situation, crash again. But then the dog because often what will happen, and often why I'm a little bit despondent about CPR under anaesthetic, is that in my experience of the last almost 11 years now, a lot of time, even if you get them back to a heart rate and breathing, they're just a vegetable. They don't.
Well, this is what
recover.
They said. It said it's because they get acidic, and after 15 minutes you would need bicarbonate, which we don't generally stock, plus after that time. And also then would require intensive care because of the repercussions. And so they say now after 15 minutes you could stop if in general practice where you haven't got you're not monitoring your blood pH and things like that.
But a lot of the time they will recrash and die
that's
anyway.
What they said.
Or
especially
never fully
ones
recover.
like her that have then got, it wasn't just
there was a reason
with her heart that caused it.
But literally, she just recovered and was right as rain, just like
and then I think
dancing
we
in
had
a
to call
kennel.
them earlier to pick them up because she was like just so awake and getting frustrated in the kennel.
So I had to call them and let them know that everything was okay, but she had died.
Yeah.
So I saw her back recently for a recheck, and they want us to the other side of the mouth. So she had a lump removed, so we'd done that because it was a nasty lump right down in her ear canal. So that was a fiddle anyway. And then we did one side of her mouth, one half of her teeth, and then she crashed. So she's got one side of her mouth, which is beautiful and healed really nice, and the other side is grotty as anything. But yeah, so she's put back in.
Bless her.
So round 2.
Yeah. But, I just feel we can. Well, we've all had our training now.
Exactly. She's had her training.
We're ready for it. Bless her.
She's half died once, you know.
Hopefully we won't have to use the app.
Poor little dog.
But that's another thing as well, though, that brings the team together as well, isn't it? You don't never want it to happen, but it always afterwards you do feel like, we did a good job.
Well, she's a lucky little creature.
Yeah,
very lucky.
She is.
So yeah,
everyone will be fighting over that anaesthetic.
I don't know when she's booked in. Actually, I don't know.
Whatever it is.
Hopefully, it's a day when I'm here. Anyway. I think
we'll
it's
make
probably
sure
on Saturday.
2 or 3 nurses around as well.
It needs to be me doing it rather than one of the other guys, I think.
Yeah, you won't be.
Yeah.
So it's been tiring, hasn't it? But then
it's been incredibly tiring a few weeks.
That is always the thing. It's tiring. It tires your brain out, and sometimes it can be stressful. But then you think, we've done 3 really amazing ops,
and all of the other
and then just everything else in between
around as well.
Yeah.
Another big ops. So we had Cooper with the foreign body.
Yeah.
That required a bit of intensive aftercare as well. So like, there's procedures like that maybe
it doesn't seem as big.
No, but for a more average practice, that would be a big procedure.
Yeah.
If you know what I mean.
And I think that is what's nice here, that no one overly stresses or panics or we just sort of slowly just get the job done, and everyone's like, well, it's got to happen.
That's
we're going to do it.
Because I don't fully prepare you for it either.
Or just not. I don't know. You don't panic, and everyone else doesn't faff. It's just like, let's make a plan, and we all talk through what we're going to do, and then you feel prepared, don't you? Because you wouldn't have just thrown the insulin Oma on us, like we all had a chat.
Normally things go as you expect as well.
Yeah.
But if you you either prepare to fail or you fail to prepare. So if you prepared to fail, then nothing's unexpected, is it?
No,
like if you prepared for all the eventualities.
Well, that's with Woody, wasn't it? We know it's a big surgery and we know it's complicated, but we prered for all the eventualities.
Like we got drugs in the fridge that we didn't use, but they're there
and
if we needed them. Yeah. And
then we ordered different foods in, not just one, because then if he's fussy, he's got different things to try. And yeah. But
yes, hopefully we'll get a guest on soon. When's the next podcast lined up for?
I don't know. I need to have a look.
Okay. You're in charge of that.
I've just about managed to get July's rota on now.
Okay.
And that's
put some on
so I haven't, for some reason, I've only got, I think, 1 appointment today, which normally my Sundays are just booked. But maybe
we need to get those letters sent out to colleagues. That would be a priority.
So I've got lots of admin-y things to catch up on today. So hopefully I'll get time. Hopefully we won't get another emergency.
We'll see.
Because there are just the 3 of us today. We normally have 4 or 5 of us on a Sunday.
Yeah.
And there's just me,
you
and
in
Georgie.
Days where we probably will have something.
Especially when I haven't got any appointments. We'll see.
Okay, right. I think we'll wrap it up at that soon.
Better go and do
Hopefully that was listenable too.
Do some real work.
Yeah, better do some real work. Brilliant. Right, thank you for listening, everybody. Well done if you got this far. And we'll see you next time. I've been Elliot.
I've been Becky.
And we've been the Vet Pets Podcast. And thank you to Vets Pets Hereford for sponsoring.